What I want to do today is share the treatment protocol that we've been going with, and then ask Morne to give you an explanation of how it's been helping him. Okay, so we're going to start Morne's treatment today by releasing off the thoracolumbar fascia, which is really bound down. And I've got a set of peri-actor transmitters for my device, and I've chosen to use the scraper. Now, this isn't, for those of you who use the Chattanooga device, this is not Shockwave. And the technique is slightly different. You'll notice that we have an adapter here that we can put our peri-actor transmitters into. And the technique is different to Shockwave. You don't use gel. We're trying to get that fascia that's bound down to glide. So we're going to be using this at a 45-degree angle, and you'll see where we meet resistance, and that's where we work through. If you are using these, never use more than 3 bar pressure on your Shockwave machine. For Morne, I've got this set at 2000 shocks at 2.7 bar pressure because we've been using it before, we've gradually built it up. Okay, so we're ready to go. Turn on the device. Okay, so now I'm going to address the upper thoracic facet joints, because we've discovered through our testing that they are what's causing the pain. And for that, I'm going to now swap to the D20 D-actor, and we're going to use our water-based gel. To improve your outcomes, ensure that you're using lots of gel. And I keep this very handy so that should the gel run away or rub into the skin, I can simply put on some more. Now, the protocol that we've been using with Morne for the last 2 weeks is the Shockwave on a Monday, and then we give 48 hours for that inflammatory response to maximise. And then we introduce our Lightforce therapy. Now, Lightforce therapy is very good at addressing pain because it has a direct influence on nociceptors, but it also optimizes the inflammatory response. So the combination, this is where research is going now, guys, the combination of therapy. So we've got a pro-inflammatory complemented by an inflammatory optimizer. Now, as I say, typically I would give that 48 hours, but as Morne has kindly agreed for us to be filmed today, I'm just going to show you the technique that I use with the Lightforce therapy. Okay, so this is our Lightforce therapy device. I'm just going to put some information about Morne in here. And you'll see that it's a 5-minute treatment. So I press standby, I give it 6 seconds to warm up, and there's quite a lot of heat produced. You'll hear the fan going, and I'll try to talk over those for you. And I'm going to be using an on-contact device. This has a silicone roller ball, which gets nice and warm, and Morne likes this treatment because it's like having a nice warm massage. but what's happening is that the light energy is being attracted to chromophores within the damaged tissue. The chromophore of cytochrome C actually is the most effective because that increases more ATP, the cell's energy source. So we can get the cell to work a lot harder, a lot quicker to repair itself. And we can also have a direct influence on the chromophores within the nociceptors. And we can block the transmission of action potential, so we can't get pain signals being sent to the brain. So what you're going to notice, I'm going to treat the source of pain, which is this lower cervical, upper thoracic area, but I'm also going to treat the associated nerve root at the dorsal root ganglion, because this is where the pain is controlled. This is where the pain location and type of pain is determined, which then signals to the brain. So I put on my protective eyewear, and over the affected area we use a grid pattern. So I'm going to work transversely over the tissue, but also longitudinally, so that I ensure that the light energy is getting into all of the cells in that affected area. By moving the handpiece, I also ensure that we don't produce too much heat in the area. Wavelengths above 1000 nanometers are attracted to water. And obviously, if we put energy in water, it's going to get hot. Now, this device incorporates two wavelengths, 810 nanometers and a 980 nanometer wavelength. So 980 is getting close to that 1000. So we know we're going to get some warmth, but we don't want that real heat. Because in a worst case scenario, we could actually burn our patients. And you see that I'm helped by this traffic light system. You'll see on the handpiece it's currently showing green. That means I'm working at the correct speed to get energy into the tissue without creating too much heat. If I go too slowly, or indeed stop, you'll see immediately it turns red and I feel vibration in my hand, and that tells me I must speed up. Equally, if I go too quickly over the affected area, I get an amber light telling me to slow down. For the next part, we haven't got a protocol for addressing the dorsal root ganglion. So I'm going to set it manually by coming into operation, and I have here the perfect protocol. Now, the area of treatment for a dorsal root ganglion is around about the size of my fist, which is around 50 centimeters squared. Treatment power, you've seen already that we've been using 20 watt, which has been quite comfortable for our patient, so I can continue with 20 watts. But the most important is the fluence, or the energy density, and this is measured in joules per centimetre squared. If you have something that's superficial, then we suggest that you start with 6 joules per centimetre squared, and if it's a deep structure, then use 15 joules per centimetre squared. Now, with those, plus or minus 20%, depending on whether we are acute or chronic. So because we're dealing with a cervical spine, which is superficial, we're going to add 20%. So I'm going to put in 8 joules per centimetre squared. Now I press equals, and the machine dictates the time of treatment. So you'll see it's very short, it's only 20 seconds, but that's providing enough energy in there to influence the nociceptive input to the dorsal root ganglion. Now with Morne, we're dealing with the suprascapular nerve, which is C6, C7, so it's quite low down. But if you have a patient where the dorsal root ganglion is higher up around there, just be careful of the hairline, because the hair contains keratin, which is also attracted to light. So this area can get quite hot quite quickly. So what I do here, I'll do about 6 to 10 circles, and then I just move across the nerve root. What I found from clinical experience is if I spend too long on this area, then it can get uncomfortably hot for the patient. You'll see the yellow light coming on there telling me to slow down. You'll see that I'm just working in small area. I do about 6 to 12 circles before I move, so that I don't generate too much heat to the area. And it's very quick, 20 seconds. It's enough energy in that dorsal root ganglion to help block those pain signals to the brain. So thank you, Morne.
No, it's a pleasure.
Much appreciated. So when you came to see us, we've been doing this protocol now of Shockwave on a Monday and a Lightforce Wednesday, Thursday, Friday for 2 weeks now. But when you came to see me originally, you were in a lot of pain.
Yeah.
Your neck movements were severely restricted.
Yeah.
We used my very crude visual analog scale, and we said 0 is no pain and 10 was the worst pain imaginable. And I stressed that, yet you told me you were a 10 out of 10.
Yes.
Okay. So this man was obviously a problem, and this was continuous, and this was waking him up during the night, and obviously having a severe effect on the quality of your life. So we've started this protocol, and we're 2 weeks into it now. So as of today, how's your neck pain?
Much better, much better. Probably about a 4.
Okay.
And I can actually move my neck, sleep better, everything.
Fantastic. Okay.
After 3 years, it's really been
a
journey.
3 years of it. And I remember you telling me at the time, putting me under slight pressure, that you felt I was last chance saloon.
I don't know what to do anymore.
Yeah.
You know, going to all the therapists and surgeons and everything, and hearing all their advice and not to do invasive surgery.
Yeah.
And this worked.
Yeah. Oh, brilliant.
Which is great.
Yeah. Okay. And we've combined the two. So shockwave therapy is more about restarting a stalled healing process. If you had something going on for 3 years, nature hasn't managed to get this right, so we needed to help her along a little bit. So we consider that as a pro-inflammatory. And then by waiting 48 hours for that inflammatory process to maximize, we could then influence it with our Lightforce therapy, which is considered as an inflammatory optimizer. Okay, so out of those two, the combination is obviously having a positive effect, but which one would you say has really kick-started your recovery?
No, I think the shockwave was definitely something I could feel immediately.
Yeah.
Immediately, within a day.
Yeah. Oh, brilliant. Yeah, I thought you might say that, because when we did it, you came to see us the next day and you went, wow, suddenly, we made a difference. So that's great. Well, look, we're still on the journey, but thank you so much indeed for sharing your story thus far.
Anytime. I'm just glad this works.
Okay, lovely. Thank you very much.